the religion standard, maybe even artistic, maybe it doesn't start at designer. But the ones that work for the advanced business.
To begin your orientation, when you enter to the clinical simulation center, you're going to be dressed in your clinical attire, just as I am now. You don't have to wear a lab coat, but you do have to wear your scrub uniform, and you have to have your hair up and your jewelry removed, including your rings, just as if you were on your clinical rotation. Your shoes, we ask that you don't wear the shoes that you do wear in your clinical rotation just for hygiene purposes. When you enter into the lab, you'll be dressed and ready to go for work. And you can place your personal belongings into the cubby holes to my right, just like this. Once you place your items into the cubby holes, your instructor will give you some directions as to which conference room you will convene with your class. There are 2 conference rooms here to my left, and there are 2 further conference rooms to my right, which you can't see at this moment. If you were going into conference room number 4, your instructor will unlock the door with her key card access. Once you have finished your preparation in the conference room, your instructor will direct you as to which room you will be going into for your learning scenario. She will tell you that you'll go into Sim Lab 1, 2, 3, or 4. And when you have your directions, you can just go to that door and wait for your cue to enter into the room. Your instructor will have to let you in with her key card access. Okay, so this is the part of your orientation where I'm going to show you the room which you will be doing your simulation scenario in. As soon as you enter into the room, you're going to notice your hand sanitizer immediately to your left and a pocket mask. And at times your faculty member may post information that you will need during your learning scenarios. You'll also notice on this wall there is a phone. This phone actually does dial out to the control area where your instructor is sitting, and you may be able to communicate with her. This is your supply cart. Just as you would in any of your clinical rotations, you're going to want to give yourself an orientation to where your supplies are kept. We just ask that you do not pull any of your respiratory equipment or supplies from this one emergency kit at the top of the cart. Instead, there is an oxygen supplies drawer at the bottom here. This over here is your medication cart. And again, just like your supply cart, please make sure that you look through these thoroughly, because during your simulation scenario, you may need to access anything from these 2 carts to fulfill your orders. On this side of the room, you're going to notice that there's 2-way glass. On the other side of this 2-way glass is the control area for this simulation center. This is a very high technological suite where we've got a mannequin that's controlled by computer. And so on the other side of this glass are the people watching and operating those controls. Your instructor may be sitting there as well. You will also see here there is a linen cart where you're going to find all of your supplies for your patient. And there's a garbage can here. And I'm pointing out the garbage can because it's very important for you to know not to put your sharps in here. We do have a sharps container, just as you would see in any of the clinical areas in the hospital. On top of your linen cart, you're going to notice your thermometer, your pulse oximeter, and your glucometer, just so that you know where to access it during your learning scenario. On this wall, you can see that it looks just like a clinical setting in the hospital. You have over here your gloves in various sizes. You have your sharps container, as I pointed out earlier. Over here is your medical gases. You will see that you have medical air. You may not see this in your clinical site, as they are currently in the process of removing them from bedsides in the hospital settings. Here is your oxygen. You see that it actually does work. It is simulated oxygen only, but you can see that it functions. And here is your suction. This is your stigmamometer. You are actually able to take real blood pressures on this mannequin, which we're going to go over right away. Over here you'll see a large cupboard. There isn't anything in here that you will need for your learning scenarios. It's just equipment that's associated with our mannequin. Over here, though, is the bedside table for your patient. And in each drawer, you will note that there are supplies in there, just as you would see in your clinical rotations. So make sure that you have a look through there and orient yourself to what is available to you for your patient. This part of the orientation, I'm going to talk about the mannequin himself and the stretcher apparatus. The mannequin is technically called a human patient simulator. And the reason why we call him a human patient simulator is because he has many of the functionalities of a real human being. You are able to get physiological feedback, and in a moment I'm going to go from head to toe and describe what this mannequin is capable of doing for you. But before I do that, I'd like to talk about the stretchers themselves. Before you start your patient care, it's a good idea to orient yourself to the functionality of your stretcher. First of all, you're going to have a look at the side rail and how you would raise and lower them. On this stretcher, the lever is at the bottom, and you would just lower as so. To raise and lower the entire stretcher, the pedals are just off to the right-hand side of the bed, and you would pump up the bed just like this. And to lower the bed, there's one toe pedal to lower the head and one toe pedal to lower the foot of the bed, but if you press on them both together, they will lower all together. To raise and lower the head of the bed, there's a lever at the very top. You just pull the lever up, raise the head of the bed just like so. Brakes. Brakes are very important. And the braking system on this one is on the right-hand side of the stretcher. To put it in neutral, or you can put it in steer by pressing down the green part of the lever. To put it on brakes, you would press down on the red part. When it's time to start your scenario, make sure that you approach the human patient simulator as if he is your real patient. He or she may be your real patient. Hello, Mrs. Nelson, how are you?
Not too bad, but I didn't sleep very well last night.
Oh, you didn't? What happened? Why didn't you sleep very well?
Oh, the patient across the hall was really noisy.
Oh, well, tonight we're going to have to do something about that.
Thanks, that'd be good.
We're just going to perform a little head-to-toe examination so that we can show the students all of the things that you're capable of doing.
Okay.
Okay. So, starting from the head, you can see that we've got a wig on this patient, and we're trying to portray this human patient simulator to be a female. So the patient may have glasses at the bedside, or hearing aids, or a number of different props that will help you identify your patient's needs. Now, at the very top of the head, this human patient simulator has ducts where you may notice that he or she is able to cry or have nasal secretions or oral secretions or even from secretions from the ear. This patient is also able to be intubated and may have other things such as allergic reactions that will cause the tongue to become swollen. So besides the secretions that you may be able to see on the head, another thing is that you'll notice this patient has got reactive pupils. The patient may have poorly reactive pupils, or they may even be blown. So it's one of the things that you can assess in your neurological assessment. Moving a little bit distally, you'll notice that this patient has an opening in its throat. He or she may be able to have a tracheostomy there. So just note that for your nursing care. Downward into the chest area, you'll notice that your patient has got regular breathing movements. We are able to program abnormal or normal chest movements and chest sounds. So you are able to actually listen to the air entry with your stethoscope and assess for normal or abnormal breathing sounds. Also notice that the patient has got cardiac sounds that you will be able to auscultate in the usual areas. This patient has got dressing over the chest. You may notice that, and it depends on the scenario that you're in, that your patient will have a number of different props that are associated with the nursing care that you are supposed to provide. This patient has got a drain as well as a dressing. Moving a little bit more distally, I would just like to show the patient has an abdomen where you are also able to auscultate vowel sounds in all 4 quadrants. Everything that I've shown you so far can be programmed to be normal or abnormal, so it's very important to take note very carefully with your stethoscope or your assessment skills. Is that the patient does have genitalia that you are able to catheterize as a part of your procedures in some of your learning scenarios. So, at this point in time, the patient has got the female genitalia as so. The male genitalia may be interchanged as required. The last thing I'd like to show you is that we have a sub-Q injection pad. When you see this on your patient, you'll know that you will be able to do a sub-Q injection in that area. You may see the pad over the abdomen, or it may be on the patient's arm. You'll notice that the human patient simulator has got carotid pulse, which is nicely felt in the neck, and a radial pulse, which is at the usual spot by the thumb side of the arm. One thing about the radial pulse is that you may find you have to palpate a little more proximally in the arm in order to pick it up properly. This patient has also got a femoral pulse at the groin, and distally has got pedal pulses, the dorsalis pedis. The next thing is the patient's legs. I would just like to show a normal looking leg on the human patient simulator, as well as we may have a pad applied to simulate an abnormal edematous leg. This pad you can actually pit and assess pitting. As well as I'd like to show you on the toes. Occasionally you'll find that the toes are lit up blue. That represents a cyanosis. You may see that in the toes and the fingers on some of the simulators, depending on how your instructor wants to program the scenario. Aside from the ID band, this patient has also got an IV inserted. On this patient simulator, the IV goes directly into a vein underneath the skin of the mannequin. The IV tubing is actually hooked up to a working Alaris pump. At this time, we don't have the pump on. But during your learning scenario, you will be required to program the pump as needed, and you may be required to change the IV fluid or hang IV meds as required, as ordered. While we're looking up this way, I'd like for you to note that there is a vital signs monitor here. This vital signs monitor gives you information about the actual physiology that we've programmed into this human patient simulator. For example, you can see the body temperature of this mannequin at this particular state is 36.5. Has a blood pressure of 117 over 77. Has an SpO2 of 98. As you interact and perform your nursing care, you may notice that these vital signs will change, either according to your nursing care or may show signs of deterioration, and you may have to intervene or take steps. This is a special blood pressure cuff that's especially designed for the human patient simulator. It will give you an authentic blood pressure, and you will just perform your blood pressure as normal, except that you'll just notice there is an additional tubing that's hooked up to the mannequin. When you do get your blood pressure, you will have to note what the blood pressure is on your vital signs monitor for you to be able to get an accurate assessment. Oxygen saturations. You notice that this human patient simulator has got an SpO2 monitor on the finger. This monitor corresponds to what is programmed in to be this oxygen saturation, as you'll note on your vital signs monitor. Your instructor may expect you to actually use the SpO2 monitor and actually apply it to your patient. But please note that you will need to read the oxygen saturations as programmed in on the vital signs monitor. The call bell is here. Very important for you to ensure that you provide your patient with the appropriate psychosocial care and give them their call bell so that they can ring you as they need to. The control area. I would like to show you where your faculty member will be sitting and leading you through your simulation scenarios. They'll be sitting behind this curtain here, and please note that they need quiet in order for them to do their work and be able to hear what's going on in each room. So as you're finished your scenario, please be sure that you keep your voices low until you get into the conference room where you're able to freely talk about your simulation scenario. So in the control area, you'll be able to see your faculty sitting, watching the scenario, controlling this human patient simulator so that they are completely interactive with all of your interventions with the nursing scenario.